All right, so today I have Mr. Jacob Fatuuuuu or Fatou. How's that pronounced?
Fatu.
Fatu. All right, I have Mr. Jacob Fatu today for liposuction. I have Mr. Jimmy as my assistant. So, Mr. Jacob, I'm just going to ask you a few questions about your history, okay?
Alrighty.
All right, now, do you have any past experience with any surgeries?
Yes, I have had a arm, but it was like because it was just broken and they had to go in and rearrange the bone.
Okay. Anything else?
No, and that's about it.
All right. Now, do you have any allergies that we should be aware of?
No, ma'am.
All right. Are you carrying any diseases?
No, ma'am.
Okay. Just gonna log that in your patient portal. Is there anything else I should know about before we go ahead? I'm just gonna briefly go over the procedure with you, and then we'll go ahead and get it started.
No, ma'am. That's all.
All right. So I'm just going to briefly go over the procedure. So what we do for liposuction is we take fat from your body and we place it. We take fat off your body, just to do a little bit of a contour and stuff like that. Do you mind standing up for a bit so I can just look around your body? All right. So I do see some areas around the hip way where we can get a little suction on. I see you got a little bit incoming love handles, which is okay, you know. You ain't gotta be afraid of that. Some women like a little loving on a man. So we could definitely remove some of this and try to give you a nice manly shape. Now we ain't gonna snatch your waist or anything like that. We're gonna leave that to the females, unless you know you want your waist snatched.
Mm-mm.
What's wrong with getting your waist snatched? You don't want your waist snatched? You ain't trying to be a baddie?
Hex no. Look, leave that for the women.
All right, so yeah, you got just a little bit of love handles. We could definitely section that out. Also, what I'm going to also do is you got a little bit of a pouch in the front, so I can section that out. Basically, with liposuction, I take the fat out and I just try to shape you as much as I can, so you don't have to, worry about anything. Now, do you have any questions for me before we get started with the procedure?
No, ma'am.
All right. Jimmy, can you give him some vitals for me, please? If you don't mind, Mr. Jacob, you sit back down. I'm gonna have Jimmy get your vitals. Okay. Oop, I just went all the way around. All right, that's perfect. Now, Mr. Jacob, you don't mind coming into the operation room for me? I'm just gonna give you a quick instructions of what I need you to do. So what I need you to do, Mr. Jacob, is I'm gonna give you a hospital gown. I need you to remove all your clothes from the rooter to the tutor. I need everything off of you. Then I'm gonna make some markings on your body so that I can know which parts I can section. You will be underneath anesthesia. So please do not worry about, feeling any pain. You'll be under anesthesia. Other than that, I'm gonna just hand you off this gown.
Okay.
Take off all your clothes. You could fold them and put them on this little table right here. I'm going to step out and, give you some privacy. Then I'm going to come back in with my marker, make a few little drawings on you, and then we're going to go ahead and get started.
Okay.
All right, so I'm going to give you a few seconds.
There we go. I have no idea. She went out the elevators. I don't know what she went for, 0 or 2.
Patient privacy is key. Oop, I shouldn't be looking. Patient privacy is key.
All right, I'm ready.
All right, good. All right, I just want you to go on ahead and lay down on the table, and I'm just gonna make some markings on you.
Ma'am, there's someone dead. There's someone dead in the
Wait,
hospital.
hold your mic.
There's someone
Okay, I'm
Don't
about
dead.
to
talk.
make some
Don't
markings.
talk.
Miss King? I'm right here. Hunter! Hunter, I'm right here.
All right, I got your sides, your back sides, and your little pouch. All right, you all set to go. I got you all marked up. Jimmy, can you please give him his anesthesia? Make sure his IV is good. And we go ahead and get started with the procedure.
Come on
Come
outside.
on,
Come on.
come on.
Okay, he should be stable.
All right, perfect. All right, we're going to go ahead and start with the procedure. All right, he shouldn't be feeling no pain. Making the first mark right now on his left side. I'm going to inject the cannula right now to suck off the fat on his left side. And you're blowing me. All right, making movements over to the right side.
Huh?
Doing some suction there. Right now, a patient
Alright.
is stable. Surgery is looking okay. All right, perfect. Okay, I'm placing the suction down, looking over areas. All right, now I'm gonna start in the front. Make sure I suction out that pouch in the front. This is why I hate this try button real bad. I gotta wait. All right, I gotta wait a few seconds. Still section out that front part. So far he's doing pretty good. Can I get a vital check, Jimmy, on Mr. Jacob? All right, perfect. All right. Still working on that front.
This way, I'm coming with
All right.
joy. Oh God,
Go away, sir.
what
Can
you
you
mean? I'm a
hear me now?
I'm a princess too. What
Go
you talking about?
away. Go away.
All right, it's whatever. It's whatever. On God, when I catch you outside, I'ma smoke
Okay,
you.
go away.
Bro, he's funny.
Oh,
Okay.
Thank you. Whew.
what she say?
Right, I was trying to see what she said.
She didn't say anything. She walked away.
Y'all,
She
there
said,
is
what she
a
said.
RP in
Something.
progress. Can
I
y'all
didn't
ladies
If
take
you
it
It
out in the
call
said, if
front?
it happens
somebody to
again,
the
get it
paramedics,
on
start.
broadcast now.
Y'all, we have a
She says if
RP
it
in
happens
progress
again.
back here. Can you guys take that in the front for me, please?
Oh, God.
Thank you. That's appreciated.
You're welcome. Trying to keep a safe environment for the patient.
Thank you. All right, he is all set. We got his body looking good. Just doing some final touches.
My favorite
All
humans.
right.
Sister.
This is why, like, come on now, y'all.
Hello.
We gonna say it did,
Mm.
for the sake of it. All right, just applying the sterile dressings on it. A little bit, few of the touches. All right, he's all set. All right, Jimmy, you can remove the anesthesia for me. I'm gonna see if I get Mr. Jacob to wake up a little bit. All right, great. Mr. Fatuuuuu, Mr. Jacob Fatuuuuu. I forgot how to say his name. Hello, my dear. Welcome back. Welcome back to the land of the living. How you feeling?
Man, appreciate it.
How you feeling?
Little drowsy, little drowsy.
All right. So the surgery went very, very well. You did amazing. Now, Jimmy here, he is going to help you get dressed. So if you can, just try to sit up a little bit slowly because I do got you patched up and everything. And I don't want you to pop any of your sutures out, okay? All right, Jimmy, you finished documenting. Help Mr. Jacob here to get dressed. And we're going to go over aftercare and his discharge paperwork. Just go here and make some loggings.
Dr. Downpour.
RP. Hush.
You said what? RP in session because what the hell is RP in session? What's that? The hell is that?
Would you like a glass of water?
Yes, please.
Let me know when he's ready, Jimmy.
Just make sure you take sips and don't try and gulp it.
All right, thank you.
Okay, I'll let the doctor know that you're ready for her to see you again.
Okay, I'm done with that.
Okay, Dr. Zanaya, he's available.
So
All
you didn't
right.
get to finish it.
Come to floor 2.
All right, Mr. Fatuuuuu, I'm just going to go over your aftercare instructions and also your discharge. So for the instructions, I need you to wear your compression garment continuously. I will provide that for you. You'll wear that except for showering for the next 4 to 6 weeks to help to reduce the swelling and support healing. Expect mild swelling, bruising, soreness, and temporary numbness over the treated areas. This is a common thing and it should improve within time. Keep all incision sites clean and dry. Change dressings as instructed, which I'll provide you with some dressings. Avoid strenuous activity, heavy lifting, and vigorous exercise for 2 to 4 weeks or until cleared by me. So I know as a man, you gonna be lifting a lot. So right now, I just need you to be like a baddie and not lift anything at all. So just kind of like be there. If you can't, we can always find help if you gotta lift any boxes and stuff. I know. But you got baddie surgery. When you get like a little baddie surgery, you gotta do baddie things. So your job right now is just to look cute and not to lift anything. Light walking is encouraged several times a day to promote circulation and reduce the risk of blood clots. So you just walking around, not running, but walking around a little bit around HP or outside, get the circulation going and you won't have any clots. And, having blood clots is a very bad thing and we don't want that. Stay well hydrated and maintain a healthy, balanced diet to support recovery. As you know, we do have a nutrition department, so if you have to speak to a nutritionist, you can about your surgery. Make sure you do have the big, large cans of, not the large cans, but when they have those big jugs of water and it goes by the set times and stuff like that. See if you could get that, or, just drink a water bottle about every 4 hours or so. Take all prescribed medications exactly as directed, including pain medication and any antibiotics, which I will prescribe to you as well. Do not smoke or use nicotine products as they can delay healing. Avoid any alcohol while taking prescription pain medicine. Also, lastly, return immediately if you experience any excessive bleeding, severe or worsening pain, fever above 101 degrees Fahrenheit, increased redness, foul smelling drainage, shortness of breath, chest pain, or any significant swelling on one side. Now, do you have any comments, questions, concerns? No emotional outbursts because you might mess up your surgery.
No, ma'am. I'm just a little disappointed that I can't do my lifting because I go to the gym every week.
I know, I know. Now you need to just go ahead and just relax for a little bit. Jimmy, if you can prepare him I need a bag prepared for a compression garment and some dressings so he don't have to like go out or anything like that. So get a bag for compression garment, probably like two, and give him a box of dressings, please. What I'm going to do is on my computer, I'm going to send a electronic prescription over to your pharmacy. So give me a second.
Can y'all transcribe that to Walgreens?
Sure, I got you, Walgreens.
There ain't no motherfucking nurses around here. Where the fuck is the nurses?
Sir, we're doing an RP session back here. We'll get to you in about 5 minutes.
I've been shot.
You messing me up. Prescription.
They locked the door.
Thank you.
You're welcome, sir.
Oh, well, I forgot to be.
I gave him an emergency supply of the prescription medication until he can get to his usual chemist.
Okay. Okay.
I will begin cleaning up the operating room.
I said pre in this per script. Okay, so I got everything sent over to your pharmacy. I gave you 800 milligrams of ibuprofen, and I also got you an antibiotic. The instructions will be attached to your medicine, but I'm gonna tell you right here. For the ibuprofen, I want you to take 1 tablet by mouth every 8 hours as needed for pain. Please take with food so it reduce stomach irritation. Also, the maximum is only 3 tablets within 24 hours. So, please don't take no more than 3 tablets. Also, for your antibiotic, you're going to take that 1 capsule by mouth every 6 hours for 7 days. Make sure you finish the whole entire thing. If you have any rash, swelling, or difficulty breathing, immediately come back, okay?
Okay, thank you so much.
You are welcome. Jimmy, I'm going to have you give him his discharge paperwork. And Jacob, I would like a follow up with you in 1 to 2 weeks, okay?
Okay.
All right.
All right, thank you. Appreciate it.
You're welcome, and I shall see you on July 30th. I'll make an appointment card for your follow up. And as you know, I will also contact you just to make sure that your appointment is set. It was
All right.
nice having you as a patient. Good luck, and remember, you have to be a baddie and not touch anything.
You know what? I'll try to keep that in mind.
All right, I'm gonna let the higher ups know you on light duty because you got your little liposuction, so you on light duty.
Oh Lord.
I gotta let the people know.
Look, at least my abs look better.
Oh, don't worry, I'm gonna have some ab sketching coming along. With the cosmetics, don't worry, I'm working on some more male surgeries.
Yeah, 'cause I'm about to say, like, when I was then, I'm like, damn, the only thing a male could really do is a lipo.
a lipo. But yeah, no
Okay.
worries. It's swelling now, but like I said, it will go down gradually and everything like that, and you get to see how your body is.
Well, thank you again. I'll keep it lightly. I'll tread the waters lightly. Won't do no heavy lifting or anything.
All
Or
right.
how you put it, be a baddie for a day.
Well, you're gonna be a baddie for about a couple of weeks, but yeah.
All right. Thank you, Ms. Anaya.
You're welcome, Jimmy. If you don't mind walking Jacob out, because as a baddie, he can't touch doors either.
You still recording, right?
Yeah, I'm about to stop.